but they need the data. And this is data from Vietnam that we're particularly proud of because Dr. L'Enfant and I have been in Vietnam now every year for the last 8 years. And we've watched these people take the GINA effort and not only implement it within their own medical schools, but this data now is from outside of Ho Chi Minh City at district level. And you can see they've implemented the GINA program. They looked at patients at the beginning and hardly any asthma control. Just very quickly after they begin to implement the program, giving the medications that are recommended, you can see the increase in asthma control that is very effective and very rewarding to not only the doctors, but of course also the patients. This study showed that the mean hospitalization rate in the first year went from 0.78 times per patient to 0.12 times per patient. This is really incredible, and it also provides again, economic information to show that if you make the medications available, you can reduce the cost of hospitalizations. Well, we've been so eager to get this message around that we've actually implemented what we call an asthma control challenge to cut hospitalizations by 50% by the year 2015. We're challenging healthcare workers to improve asthma control, and we have the theme, improve asthma control and reduce hospitalizations. And we're working again with our ambassadors, asthma ambassadors, to collect the data so that we can show that even in small hospitals, even at the district level, that we can reduce hospitalizations by good asthma control. Well, how are you doing here in the United States? So I'd like to remind, I'm going to show first the slide that I showed at the beginning. This was the data for deaths from the year 80 to 85, again showing the increase in the white, the black female, and the black males. How are we doing now in the United States in the decades of the 90s and the 2000s? Well, you can see that slowly death rates are going down, but it's still an important problem in the black and white, black male and black female populations. In spite of the fact it's going down, it's still an important problem. I showed you at the beginning of the talk the hospitalization rates for asthma here in the United States during the decades of the 1980s. And you can see, as you saw, that the increase in all age groups. How are we doing today? Well, here in the decades of the 90s and the year 2000, hospitalization rates are slowly going down here in the United States. Whoops. Unfortunately, not very quickly, and they're still very high for under age 15, and it's particularly high for age 65 plus. So there's still work to do here in the United States. But I'd like to introduce you to a somewhat complex slide, but I think it's very important because it brings together all of the things we've been talking about so far. When we were working in the Heart, Lung, and Blood Institute in the year 1995, so that's 15 years before the target date, we were asked to present targets for what they call the government, the Department of Health and Human Services, calls their Healthy People Target Program. Now this is important because that meant that the Health and Human Services, your Ministry of Health, identified asthma as being an important target. And so important that they asked the Heart, Lung, and Blood Institute in the National Asthma Program to identify characteristics. These would not be vital statistics. These are characteristics of what would you like to see accomplished in 15 years if there are effective asthma programs. And so these were the characteristics that were chosen. Are patients being taught how to use an inhaler? Are they given an asthma management plan? These were all taken directly out of the NAEPP. Were they taught to recognize early signs and symptoms of asthma? Were they advised to change their routines at school and how to respond to an episode of asthma? So these were all patient involvements. We set targets, as you can see. These were targets that were set 15 years earlier that we hope to achieve by the year 2010. Well, you can see from this graph that this is data that's published by the National Health Statistics Reports in January 2011. And you can see that some of these targets were pretty good. And this is US data. These are percentages of people who see doctors in the United States. 96 and almost 97% of the people report that they are taught how to use an inhaler. Yet only 34% of the people report being given an asthma management plan. This is something that we need to work on here. 60% of people said they knew signs and symptoms of asthma. 50% of the people, just our target, to change how they respond to risk factors. And 68% know how to. So this is pretty good information. So I think this might be more important. The fact is, you are, as physicians here in this country, making people aware of interacting between the healthcare provider and the patient. So these are very encouraging data. Well, there's of course a lot that needs to be done. We need to continue to expand and evaluate new and existing medications. This, I think, is a very exciting field, and many of you are actively involved in this part of the work. We know that severe asthma is an important problem that we need to continually to work on. And we're talking very much within the GINA program of perhaps targeting some of our documents more at some of these special populations. We know that there is a great interest in asthma COPD and the differential diagnosis. This is a very important issue, especially out in the field, that we need to pay more attention to. And not only do we need to continue to provide good information, but we really have to do better at how to implement effective programs. These are our goals for the future. But I'd like to tell you just a few more program notes here. We had a wonderful trip to Mongolia in the year 2004. If you've ever been there, you'll recognize this countryside. This was in May, and it looks as if you're on the moon. We were taken to see how they treat asthma patients, as they knew we were asthma specialists, and this is what we were shown. This was an asthma clinic in Mongolia in the year 2004. We met many people there. We invited them to become a member of the GINA Assembly. We sent them all of our documents, which were rapidly translated into their language, and they had some support to help disseminate it. So it took just 4 years later, in the year 2008, when we were invited back to the same country, the same month of the year, and here we were invited to speak to representatives from healthcare clinics throughout the country. We presented the GINA program. They asked us questions, and they were very enthusiastic to see it. One of the big problems in this country, as there is in many other countries, is the importance of the availability of effective medications. This is a real problem. We realize that it has to be considered if we're going to continue to make progress. This is why I keep saying it's so important for the people, the Ministry of Health people, to recognize that if you take asthma control, you can give medications, you can reduce the burden, and you can reduce the expenses. Well, one of the outcomes of the GUARD program has been the development of what is called an asthma drug facility, which is sponsored by the International Union Against Tuberculosis and Lung Diseases. But there, it's a very important part of the whole asthma care picture. They provide access to affordable, quality, assured, essential drug medications through this program. So using principles of some of the GINA programs, but having access to medications, you can show how to improve the management of asthma patients in low and middle income countries. So has there been an impact of all of this work? Well, yes, we think there has been, but we also recognize there's much more to accomplish. So thank you very much for your attention, and we look forward to hearing from all of you in the years to come as we move forward on all of these very important issues, and especially to Dr. Sheffer for inviting us to come here today to present this program, and Dr. Fanta as well. Thank you very much.
Thank you very much. It's quite inspiring, this story. And we have time for questions, but before we do, I wanted to officially thank Dr. Hurd for her visit and share with you, as a memento for your visit, a Partners Asthma Center scarf.
Thank you.
And we have, you'll be warm. And we have for both you and for your husband a Partners Asthma Center mug to enjoy coffee together with in the morning, and a little and something to lug all the loot home with. Great. So anyway, thank you very much. And
well, I was interested last night. I was interested to hear from dinner that there were other people that had seen the asthma treatments from Mongolia before.
Cupping.
So the cupping, yes. I had not realized that it was something that was well used, I guess, by many countries. But it was something to see. And we were glad that we were able to get some connections to the GINA program. It's also interesting in Mongolia, it turns out that the main partner country is Russia. And so we were able to provide some links between the Russian people and their drug companies with the Mongolian companies. There's virtually no drug preparation or making in Mongolia, so they are totally dependent on receiving medications from other countries.